Right now, I want you to try something simple. Take one slow swallow and pay close attention to the back of your throat. Does it feel like something is lingering there? Maybe a sticky layer, a heavy sensation, or mucus that refuses to disappear no matter how often you cough or clear your throat. Now think about this for a moment. How many times have you cleared your throat today? 10? 20? Maybe so often that you no longer notice you're doing it. And if someone asked you exactly when this problem began, chances are you couldn't give a clear answer. It probably didn't appear overnight. It started subtly. At first, you noticed it only when you woke up. Weeks or months later, it stayed with you longer. Eventually, it became something you deal with from morning until bedtime. You may have started carrying a bottle of water wherever you go. Perhaps you've stopped eating certain foods because they seem to make things worse. Maybe you've already tested every home remedy suggested by family members, friends, or neighbors. Yet, despite all those efforts, the constant mucus is still there. Here's something important that many people never hear. Persistent throat mucus is usually not happening without a reason. It isn't simply a normal part of getting older. Your body rarely produces ongoing symptoms for no purpose. Instead, it uses them as signals that something underneath needs your attention. The challenge is learning how to understand those signals instead of just covering them up. That's exactly what we're going to do today. Throughout my years working in preventive health with older adults, I've noticed that chronic throat mucus is one of the most misunderstood complaints people experience. Many are simply told to suck on lozenges, sip more water, or wait for it to improve. Too often, the conversation ends there, while the real cause continues quietly in the background without ever being investigated. Today, we're going to approach this differently. I'll explain 5 research-backed reasons why adults over the age of 55 often struggle with persistent throat mucus. More importantly, I'll reveal something that many discussions leave out. In a large number of cases, 2 of these causes are happening at the same time. They feed into each other, making the mucus thicker, more persistent, and much harder to get rid of. Once you understand how these 2 problems interact, the entire picture starts to make sense. Welcome to Wellness Science Hub, where our goal is always the same: to share trustworthy health information using simple language, supported by research, along with practical steps you can begin applying today. Before we continue, I'd like to hear from you. Is your throat mucus at its worst when you first wake up, or does it stay with you throughout the entire day? Believe it or not, that one detail provides valuable clues about what may be happening inside your body. Leave your answer in the comments by writing either morning or all day. I enjoy reading your experiences because they often help shape future discussions. Now let's begin with something most people have never been taught, even though it completely changes the way you think about this issue. Your body naturally produces mucus every hour of every day. That's not a problem. It's actually a sign that your body is working exactly as it should. Mucus serves as a protective barrier throughout your airways. It traps dust, bacteria, viruses, and other tiny particles before they can travel deeper into your respiratory system, helping to protect your lungs and keep your air passages healthy. Mucus also acts as a protective shield, keeping the delicate lining of your throat hydrated and flexible. Without it, those tissues would dry out, develop tiny cracks, and become much more vulnerable to bacteria, viruses, and other harmful particles you encounter every day. So the mucus itself isn't the enemy. The real issue is what changes happen to that mucus as we grow older. There's an important process inside your body that many people have never heard of, even though research has clearly shown how important it is. It's called the mucociliary clearance system. Your airways are covered with millions of tiny hair-like structures known as cilia. These microscopic fibers work around the clock, constantly sweeping mucus upward so it can be removed before it builds up. They perform this task thousands of times every day without you ever noticing. When you're younger, this cleaning system is incredibly efficient. Fresh mucus is produced, moved along, and cleared away almost immediately. As we age, however, things begin to slow down. Studies have found that these tiny cilia don't beat as quickly or as effectively as they once did. Because of that, mucus that would have disappeared within seconds in your 40s may remain sitting in your throat for hours by the time you're in your 60s or 70s. Why does that matter? It means that anything causing your body to make extra mucus has a much greater impact later in life. The mucus stays around longer, becomes thicker, and is far more noticeable than it would have been years earlier. This isn't simply an unavoidable consequence of aging, it's basic human physiology. Understanding this one concept helps explain nearly everything we're going to discuss next. With that foundation in place, let's look at the 5 most common causes of persistent throat mucus. Pay close attention because some of these problems frequently occur together, making the symptoms much worse than either one would cause on its own. The first cause is one of the most overlooked, even though research repeatedly identifies it as one of the leading reasons adults over 55 struggle with constant throat mucus. It's known as laryngopharyngeal reflux, although many people have never heard that name. Let's make it simple. Most people recognize traditional acid reflux because it causes heartburn, a burning feeling in the chest after eating. But there's another form that's much quieter. This version often causes no burning in the chest, no stomach discomfort, and no obvious digestive symptoms at all. Instead, the only sign may be a throat that constantly feels irritated or coated with mucus. Here's what's happening inside the body. Where your esophagus connects to your stomach sits a ring of muscle that works like a valve. After you eat, its job is to stay tightly closed, preventing stomach contents from traveling back upward. Over time, this muscle can gradually weaken. Think of it like an elastic band that has lost some of its stretch after years of use. Once that seal becomes less effective, small amounts of stomach acid can move upward, not only into the esophagus, but sometimes all the way to the throat, voice box, and even the back of the nasal passages. This is where the problem begins. Unlike the stomach, the tissues lining your throat are extremely sensitive to acid. Even a tiny amount can irritate them. When that irritation occurs, your body's natural defense system immediately responds by producing thicker mucus to coat and protect those delicate tissues. From a biological standpoint, that's exactly what it's supposed to do. The problem is that if this happens repeatedly while you're lying down asleep, you wake up every morning with that familiar feeling of mucus collecting in your throat, often without realizing your stomach is involved at all. Because there's no classic heartburn, most people never suspect reflux. Clinical ENT research has shown that nearly half of people with this condition never experience chest burning. Instead, they notice ongoing throat clearing, a hoarse or raspy voice after waking, and mucus that starts building up almost immediately each morning. Take a moment to think about your own symptoms. Does your throat feel noticeably worse when you first wake up? Do you find yourself clearing it more often after bending over? Has your voice become rough or husky early in the day before gradually improving? Those are all common clues pointing toward what's often called silent reflux. Later in this video, I'll share practical strategies that may help reduce these symptoms starting as soon as tonight. There's one more important point to keep in mind. If you regularly use anti-inflammatory pain medications for arthritis or joint discomfort, such as ibuprofen or naproxen, research has found that these medicines can reduce some of the stomach's natural protective defenses. As a result, both traditional acid reflux and silent reflux may become more likely or more severe. If that sounds familiar, it's worth mentioning this connection during your next appointment with your healthcare provider so you can discuss whether your medication could be contributing to the problem. Before we continue, I'd love to know who's watching today. Leave a comment with your first name and the place you're joining us from. Everyone in the Wellness Science Hub community has a unique story, and I truly enjoy reading where you're all tuning in from. Now let's move to the second common cause. This one often develops so gradually that many people don't even realize it's happening. When most of us think about sinus problems, we imagine severe congestion, facial pain, headaches, and a completely blocked nose. But for many adults over 55, chronic sinus inflammation looks very different. You may breathe normally. You may not have headaches. Your nose might not even feel stuffed. Yet inside your sinuses, mild inflammation continues day after day, causing them to produce just a little more mucus than usual. That mucus slowly drains down the back of the throat without you even noticing. This condition is called postnasal drip. Interestingly, a 2024 study found that the average age of patients seeking treatment for postnasal drip was 55 years old, showing just how common it becomes during this stage of life. One reason this condition is so frustrating is that many people assume it's caused by seasonal allergies. They buy over-the-counter antihistamines and hope for relief. Unfortunately, that approach often falls short. While antihistamines can temporarily dry up mucus, they don't address the chronic inflammation inside the sinuses that's producing the mucus in the first place. In fact, overly dry mucus can become thicker and stick more stubbornly to the back of the throat, making the sensation even more uncomfortable. One of the simplest approaches supported by research is regular saline nasal irrigation. Using a warm saltwater rinse helps flush away excess mucus, reduce swelling inside the nasal passages, and support the natural cleaning action of the cilia we discussed earlier, the same system that naturally becomes less efficient with age. A comprehensive clinical review published in 2025 concluded that saline nasal irrigation is a safe, inexpensive, and effective method for helping manage and prevent many upper respiratory conditions. For that reason, ENT specialists around the world commonly recommend it alongside other treatments. The key isn't doing it once in a while. The real benefit comes from making it a consistent daily habit. Using it occasionally may provide short-term relief, but regular use allows the effects to build over time, leading to much more noticeable improvement. Later, I'll explain exactly how to perform nasal irrigation safely and correctly so you can get the greatest benefit. If you've made it this far and you're finding this information valuable, type the number 2 in the comments so I know you're still watching. And if you haven't already, don't forget to subscribe to Wellness Science Hub so you won't miss future videos focused on healthy aging, prevention, and practical wellness tips. Your support truly helps Wellness Science Hub continue creating educational content like this, so thank you for being here. Now let's move to the third cause, because this is usually the point where people are genuinely surprised. When someone comes to me with constant throat clearing or stubborn mucus, we carefully review everything that could be contributing to it. One thing that almost never crosses their mind is their prescription medication. Most people assume that if a medicine has been helping them for months or even years, it couldn't possibly be responsible for a new symptom. But sometimes that's exactly what's happening. One group of medications deserves special attention. They're called ACE inhibitors, short for angiotensin-converting enzyme inhibitors. These medicines are commonly prescribed to manage high blood pressure and certain heart conditions. Millions of people take them every day, and for most patients, they work very well while offering significant health benefits. However, they also have a well-documented side effect that many people aren't aware of. These medications can cause a natural substance called bradykinin to build up inside the body. In some individuals, that increase irritates the throat and creates an almost constant urge to clear it. Research suggests this occurs in roughly 5 to 20% of people taking this class of medication. The important thing to understand is that this doesn't mean you're having an allergic reaction or that something is seriously wrong. It's simply a recognized effect of how the medication works, combined with the fact that some people's throats are more sensitive than others. One reason this connection is overlooked so often is the timing. Unlike many medication side effects that appear almost immediately, this one may take weeks or even several months before it becomes noticeable. Imagine you started a blood pressure medicine 8 months ago, but your throat irritation didn't begin until 2 months later. Most people would never think those events were connected, yet that's exactly the delayed pattern described in medical studies. One large study involving more than 27,000 patients found that adults over the age of 65 were about 53% more likely to experience this persistent throat irritation than younger individuals using the same medications. That makes this information especially important for older adults. If you're taking medication for high blood pressure and you're not sure whether it's an ACE inhibitor, your pharmacist can usually answer that question within a minute. If it is, don't stop taking it on your own. Instead, schedule a conversation with a healthcare professional who prescribed it. There are other medication groups, including ARBs, or angiotensin receptor blockers, that often provide similar blood pressure control without causing this particular throat-related side effect. It's a discussion that's well worth having.